Federal Drive is presented by GEHA, Government Employees Health Association, proudly providing health and dental benefits to federal employees and their families. Visit GEHA.com.
Modernizing preparedness law requires more than updating language or refreshing authorities. It means confronting where coordination, capacity, and accountability have fallen short under stress as threats have evolved. Here to walk through some key considerations is U.S. Policy and Advocacy Officer at the Global Health Technologies Coalition, Alex Long. Alex, it is great to have you on the show. Thanks for joining me.
Thanks so much for having me.
We're going to talk about the Pandemic and All Hazards Preparedness Act, now titled Protecting Americans from All Hazards Preparedness Act. This act was authorized 20 years ago and it's been through several different reauthorizations. In its growth or its maturity, how would you say it has changed for the better and then maybe not changed where it should?
It's a great question. So, in 2006, when it was first passed, I think the two backbones, let's say, of the legislation were the creation of the Assistant Secretary for Preparedness and Response and the Biomedical Advanced Research and Development Authority, which is ASPR and BARDA. Now, ASPR was tasked with handling public health emergencies and coordinating them, or emergencies that dealt with CBRN threats, which is chemical, biological, radiological, and nuclear. And then BARDA was tasked with distributing and developing countermeasures very quickly to address the threat. So if that's where we started in 2006, I think it's really important for people to understand why that was created. And it was in response to 9/11 and the anthrax attacks of 2001, which I know 2006 feels like a long way away from 2001, but there was a lot going on. And that was the impetus. So through its other reauthorizations in 2013 and 2019, different events preceded those reauthorizations of the original 2006 bill, which gets to your question where it has evolved because it's had to. So in 2013, when Congress took another crack at it to reauthorize, we had just been through H1N1. And we realized that our response capabilities were not ready for pediatric issues. So within the 2013 bill, it addressed more pediatric medical countermeasures and the creation and response to pediatric communities. And then the 2019 bill, we had just gone through Ebola and Zika, which were two infectious diseases. And we realized that in 2006, I think most of the capacities that PAPA set up were for man-made biological threats. And we were increasingly coming into a world that was very global, a lot of travel, et cetera. So infectious diseases and disease spread needed to be centerpiece to this 2019 piece of legislation. So it evolved to kind of meet that moment. I would say now that we're 20 years into this process, as you could imagine, the next PAPA hopefully could address and could evolve to address the shortcomings that happened during the COVID-19 pandemic.
Well, one would hope that we wouldn't have any trouble reauthorizing it with COVID sort of still in recent memory, but the authorization actually lapsed in 2023, and we haven't been able to move forward an agreed upon reauthorization. How is Health and Human Services thinking about all hazard preparedness today?
I know that the people who are working within ASPR and BARDA right now, it is still central and very important, especially with rising threats that are brought to us because of, emerging technologies and AI. But without going down that rabbit hole, I do know that the people working there are really focused on this issue. And I think that what they're looking for is a signal from Congress that Congress is also focused on this issue. And the reason why we're here today to talk about 20 years of PAPA and to talk about a potential reauthorization is because it seems like there might be some motivation on behalf of Congress. But without that authorization, without a new PAPA, we're a little bit in the dark as to what we should be doing next as a country. And I think that, again, agency officials are looking for those directives from Congress.
In the different competing versions of reauthorization proposals that have been offered but not passed yet, what would you say are some of the critical modernization efforts that they've included?
So back in 2023 was the last time that Congress really tried to reauthorize PAPA post-COVID. And without getting into too many of the details there, it was really just a very partisan situation that kind of led to it not seeing the light of day and getting passed. So within this new PAPA that we're hopefully going to be able to push through in this Congress, which I should mention is highly unlikely, but something that we could really hope for, we don't really know what is going to be in there right now because the process is so in its infancy. And I think that's really important to mention. But I will say, we learned a lot from the pandemic and from what we do have and from what we don't have. And one thing that we really learned, especially through BARDA's Operation Warp Speed, is that if you give a lot of money and a lot of focus to a problem, BARDA is able to solve it. And I think the Operation Warp Speed is an incredible success. But I would be remiss to not mention the fact that that money that got to BARDA to tackle the COVID-19 vaccines was done through emergency appropriations and an emergency supplemental. So I think a lot of people in the global health community and the biosecurity community are really looking for Congress to vest BARDA with more explicit funding for emerging infectious diseases so that we don't have to go through the process of doing an emergency supplemental for funding when an emergency is already here. And I think, we saw that with Ebola and Zika too. Those responses were also funded through emergency supplementals rather than a standalone program that had a sort of war chest ready for the moment. And I think through new PAPAs, we could hopefully get some sort of increased funding for threats of that nature. And also, supply chain issues that we saw when people aren't countries are not engaging in trade anymore with us. And then also just the strategic national stockpile and understanding what is in it and where those things are across the nation, I think is another big push for the next PAPA.
I'm speaking with Alex Long. He's U.S. Policy and Advocacy Officer at Global Health Technologies Coalition. Alex, you've talked there a lot about the medical challenges that are associated with this. I want to talk about organizational challenges for a minute, because PAPA touches multiple agencies: Homeland Security, Health and Human Services, the FDA, and others. What are some of the cross-agency collaboration challenges that you'd want PAPA to address?
Yeah, so PAPA set up the FEMC, or Public Health Emergency Medical Countermeasures Enterprise. So again, I will call it FEMC from here on out. And that includes all of the agencies that you just mentioned. And one way that FEMC really works well is Department of Homeland Security is able to identify different material threats, put together a list. BARDA is then able to take that list, create medical countermeasures for it, and then the FDA is able to move those through in an expedited way if a threat is imminent. So that's one way that coordination really works across these agencies. But I think one thing that it's currently missing is an interplay from the Department of State. This administration has really centralized a lot of global health at the Department of State and global health security. And I do believe that, especially if we want to have a FEMC that is forward-looking and monitoring the threats all across the world, incorporating the Department of State into it would probably be beneficial. But then also, I think since COVID and since we didn't have another PAPA, there have been really great strides made in a bipartisan manner, which I cannot emphasize enough is so necessary to biosecurity as bipartisan bills. There have been many that have been passed since COVID that set up certain offices across the U.S. government, and I would love to see in the next iteration of PAPA those offices having clear marching orders and coordination mechanisms so that during maybe the next threat, whether it be biological, chemical, radiological, or nuclear, there's a clear messaging strategy from the administration and from the right people, from the right organizations. And I think that we saw that during COVID, the messaging wasn't perfect. So I think strengthening that and strengthening these new offices and giving them a real place in this response process is critical.
That's really helpful. But let's follow through what's likely to happen, which, as you said up front, is not reauthorization. So in the absence of reauthorization, what do you think are the biggest risks out there that this network of agencies and organizations and projects is going to have to deal with?
Well, I mean, I think funding and strategy are two things that all of the different agencies that are incorporated in PAPA really need, which is why a PAPA would be so great to, if not pass in this Congress, the next one. And again, it's currently being led by Representative Neil Dunn, Representative Lori Trahan in the House, a new effort to put it back on the docket and back into the conversation, which is the first step. Hopefully their Senate colleagues will agree and, take it up as well. And then we can have some sort of bipartisan process. That would be perfect. But as you said, potentially unlikely. So what has been able to happen since the reauthorization lapse in 2023 is congressional appropriators have kept funding and kept reauthorizing small parts of PAPA through appropriations bills, which happen every year. So we have been lucky that there is clear like push to fund those things, but to make sure that that funding does not lapse and that because there is no authorization, funding does not follow. Funding usually is much stronger if there is authorization attached. And that allows the agency to put together like 5-year plans that would give people more foresight who are on the ground, actually like contractors for BARDA, so that they could build their own company strategies and organizational strategies around BARDA's new strategy, which a PAPA would allow for. So there's all of those issues, plus like we don't know what the next threat is. So I think that we're in a really tough spot if we don't somehow get this conversation back moving, and if not passing this Congress, then the next one.
I've been speaking with Alex Long. He's U.S. Policy and Advocacy Officer at Global Health Technologies Coalition. Alex, thanks so much for joining me today.
Thank you so much for having me.
We'll post this interview at federalnewsnetwork.com/Federal Drive. Subscribe to the Federal Drive wherever you get your podcasts.